I will start my lecture about the thyroid RF ablation, complications, and its management. This is my COI. As you know, this is a published paper about the complications of benign thyroid nodules during our RF ablation. This multi-center study enrolled 1,459 patients from 13 institutions. The most common and serious, one of the serious complications is voice change, about 1% of incidence, and followed by hematoma, vomiting, skin burn, some kind of nerve damages, but all recovered without problem. But one patient with abscess formation and one patient with hypothyroidism was managed by surgery and medication. Therefore, sequelae rate in this study was 0.14%. What about the recurrent cancer? The complication of RF ablation for recurrent cancer is also voice change is the most common complication, about 8%, very high compared with benign thyroid nodules. And what about the cancer, thyroid PTMC? Voice change is also most common complication during ablation of PTMC. And here is complications of a parathyroid intervention. And this table shows ethanol and the razor and the RF ablation show the voice changes more than 8%. It is most common complication, followed by bleeding, some symptomatic hypocalcemia, and Horner syndrome caused by injury of sympathetic ganglion. So as I introduced, the voice change is most common and one of the serious complications of RF ablation, regardless of thyroid, parathyroid, benign, or malignant lesions. Therefore, today, I will talk about how to manage voice problem during RF ablation. I will talk about the value of cold water injection. Cold water, we use 5% dextrose water as a cold water injection. Let me show first case. This case shows a recurrent tumor in right OP bed. Here you can see the trachea and esophagus. The tumor is very close to esophagus. We first separate the tumor and esophagus by hydrodissection technique, and then treat the tumor by RF ablation. However, although we used the hydrodissection, the patient complained of voice change during ablation. So we injected cold water, I mean the 5% cold dextrose water at tracheoesophageal groove, because here is the common location of recurrent laryngeal lobe. We inject cold water continuously and the patient recovered completely. The second case shows a huge benign thyroid nodule. You can see the compression of trachea and esophagus by big thyroid nodule. During RF ablation, the patient complained of voice change, and I also inject cold water at the tracheoesophageal groove. We continuously inject, and the patient recovered completely. Based on our experience of cold water injection, we published this first retrospective study. In this study, we experienced 3 kinds of nerve damage: recurrent laryngeal lobe, sympathetic ganglion, and vagus nerve. What about the result of cold water injection? When we injected and not injected group, when you compared, what about the recovery time? It's much shorter in injection group. So in this retrospective study, I would say cold water injection is effective to control damaged nerves. After this study, our daily practice was totally changed. When there is voice change, we inject 5% cold water in every case. So you can see this prospective validation study. We divided two groups. We found 19 voice change problem, and we injected cold water in all patients, and we divided two categories. Immediate recovery was detected in 15 patients, but 4 patients showed late recovery. What is the cause of late recovery? We found delayed detection of nerve damage is important cause of late recovery of voice. So we recommend frequent checking of voice problem during your ablation. Here is my one question. What about the amount of cold water? Cold water amount. This third case shows this patient received 2 times of surgery and 2 times of radioactive iodine therapy, but we found light OP bed recurrent tumor obtaining to esophagus. You can see the esophagus here and spiculated tumor. As you can see, this tumor shows a very spiculated margin. That means a more aggressive tumor. So we separate the tumor and the esophagus by hydrodissection and then treat wide ablation. You can see the wide ablation zone that cause voice change. So I injected more than 300 cc of cold water in tracheoesophageal group like this. The patient recovered voice problem. So we recommend inject cold water as much as possible until recovery of nerve symptoms. And our guidelines suggest local anesthesia rather than general anesthesia or sedation to check nerve damage symptom during RF ablation. Please remember, local anesthesia would be safe. So this is our protocol. During daily practice of RF ablation, we check voice problem frequently. And when there is voice change, we immediately inject cold water as much as possible until recovery of symptom. And finally, we inject 1 or 2 ampules of steroid around the nerve. This is our protocol. Thank you very much for your attention. Dr. Yang asked me the temperature of the cold water. The cold water we used not room temperature, around 0 to 4 Celsius degree, very cold water. It's dextrose water, yes.
A follow this question is there, can we use other water such as normal saline to inject it? Can we?
Yes, but as we know, dextrose water is more safe Then normal
Okay.
saline, yeah, because
Okay.
there is no ion inside the dextrose water.
And now they have another question is, do Dr. Baek re-aspirate the injected water or not? Dr. Baek?
No, I remain because it has a function, continuous function around the nerve. I
And
remain.
I think,
Mm.
yeah, sorry.
No. You.
Yeah, and Dr. Baek just told us to try to inject as much as dextrose water until recover of the symptom. So it comes to another question is that if we inject too much the dextrose water, do you think it will compress the airway or not?
Airway?
Airway compression to the airway, the trachea.
No. That's no problem. Yes. No problem because the injected water continuously drain along the neck structures.
Okay, I think that the usually anatomy of the neck is very smooth unless they have accept any treatment might lead to the adhesion. So the normal dextrose water, even we inject a lot of water, the water would flow out to other area and that would not cause a compression. I think maybe this reason, right, Dr. Baek?
Yes. And this.
And some question might repeat, and Dr. Baek have already answered that. And another important question is that, Dr. Baek, do you plan to press the needle for cold water prior to abrasion to avoid abrasion hemping needle placement?
Yeah,
Do you?
No, we simply prepare the needle and the cold water just beside my devices. And if there is a voice problem, we prepare and inject immediately. Yeah. We use a hydrodissection technique. As we know, we use a hydrodissection technique during RF ablation, but we do not use too much water because too much water disturb our RF ablation procedure. That is why voice change is induced although we use a hydrodissection during ablation.
Okay. I see most of all they might focus on how much the water we should inject it. So one audience asked Dr. Baek that if the symptom is persist, even we inject a lot, how large of the amount of water you inject until now during your all procedure?
Yes, we inject until nerve symptom improve.
Even more than 300? Even more than 300?
Yeah, more than 300. Yes, 300 is one of the largest volume I injected.
Okay. So another audience asked that once the patient's voice has recovered, should we continue to do the ablation or stop?
Yes, yeah. I sometimes continue ablation. That is why I use dextrose water rather than normal saline.
So how fast? Because a lot of audience might ask, when should we stop inject the cold water? And I think it was related to the amount of water injected. So the following question is how fast we inject the cold water?
Bolus injection.
Bolus
Bolus,
injection?
yes, as fast as possible.
So for example, if you want to inject 300 milliliter water, how fast should we inject? all of.
Because I usually use the 21 gauge needle, 21 gauge, and
Yes.
we inject bolus injection. We use
Okay,
bolus injection.
So I think Dr. Baek have this is a question that raised a lot of questions. So
In my, I will answer for one question, and there are two questions about the complication of injected fluid. They asked any kind of infection, inflammation, or abscess formation after injection of cold water. There is no experience.